afternoon. I'm Dr. Barbara Casper. I'm the Chief of the Division of General Internal Medicine at the University of Louisville, and I'm delighted to be here and speak with you today. Hard to follow Jacob/Jason in his talk. He did an excellent job, and he is actually he's one of the people that we really need to focus on in our efforts to correct our tobacco problem in our state. I won't reiterate what some of the other speakers have mentioned about the health effects, but I would like to say I'm a primary care physician. I've been practicing for 20 years in Kentucky and came from a tobacco growing state of Tennessee. And I noticed even though my state there grew tobacco, there's a definite difference in the number of folks who use tobacco in Kentucky. And watching the ravages of that disease over 20 years of my career has been really sad, and watching people die from potentially preventable illnesses. We've talked a lot about heart disease and about cancer, but also I've watched many people smother to death from COPD, and that is probably one of the most miserable ways to die that I can remember. Many of these people have smothered and continue to smoke, and I think that speaks to the strength of the addiction of the nicotine, and most of my patients want to quit smoking. So I think that giving them a little bit of an impetus by increasing the cost of the cigarettes, in addition to making our public spaces smoke-free, would really help to propel them to try to quit smoking. I had the opportunity several years ago as Louisville was addressing the smoke-free environment to speak at our Metro Council in favor of smoke-free Louisville. And I will say the hospitality industry was very strong there and was really objected to making restaurants and other businesses smoke-free with a concern that it would affect their business. And so we've been smoke-free for quite a few years now. I can't remember how many years it is. But I can tell you that it has not at all impacted the hospitality industry. Our restaurants, our clubs, our bars are still going strong. So a lot of the concerns that were expressed